My name is Vincent Atkins, Trade Policy Advisor at the Office of Trade Negotiations of the Caribbean NCD. Right, the members of the last panel, of course, we are well beyond the time scheduled to end for today. As a result, I would ask our panelists to stick rigidly to the time allotted, which is no more than 5 minutes. And note that I frame it as, yeah, the letter you got said 10 minutes, but that was when the meeting was within the schedule. So that, yes, if you can stick rigidly to the time, I read a minute out of respect to those persons who have remained here up to this time. Of course, the theme for this session remains the same as the 2 previous sessions. NCD Policy and Programming, taking stock and informing priorities, national and regional perspectives. One of the issues which surfaced, and which perhaps was not addressed in much detail, was that of the conflict of interest. We noted in several of the presentations that the conflict arising as a result of the different interests of stakeholders came to bear or was brought to bear on the policy formulation process. Although the panelists were not necessarily asked to focus on that particular issue, it would be useful if you do, and still respect the time frame, of course, that you are asked to make a presentation. So that to the extent to which you were able to address the issue of conflict of interest, how you were able to deal with that, including how you selected a particular interest group or particular entities as part of your multisectoral team, because of course your focus is the multisectoral response. And as I said, only to the extent that you are able to address that particular issue because of the prominence of the issue of conflict of interest in addressing the NCD concern. So with that, let me invite the first speaker from the Bermuda NCD Commission, Dr. Virloy, Lewin.
Good afternoon, everyone. I'm going to try to stick to that 5 minutes. Okay, all right, yes. So I'm going to talk a little bit about the Bermuda Partnership, which currently serves as the National NCD Commission equivalent and has a mandate broader than NCDs. As you can see, the strategy is organized around 3 themes, which is healthy people, healthy families, and healthy communities, and 18 goals. Some of the successes that we've had is the partnership provides opportunity for agencies to network and synergies. And 10 to 11 of the action plans are delivering interventions. It's also a collaborative approach of pooling resources. We've also established the Bermuda framework for the implementation of the strategy, and partnership agreements were signed to solidify lead agency commitment to the Bermuda strategy. And as you can see, there are various goals that we have on healthy weight, heart health. And so this involves a lot of different agencies, NGOs, private partners who are taking the lead role on these goals. So challenges and lessons learned, we have competing priorities or agendas, the ownership of the strategy and goals and objectives. We've tried as much as possible for our lead agencies to own the goal, but sometimes it happens where there are other agency issues come up and those things are put to the side. Also, human and financial resources are always an issue. And under representation of other sectors as well, sometimes there's still some siloing going on, and we want to try to bringing as many of the private sector agencies into the strategy. Also measuring effectiveness, lots of activities going on, but are they impacting change? And I think we need to build capacity in terms of evaluation. So actions needed to achieve an enhanced multisectoral response. Just going to give you some background. The Department of Health in Bermuda had a health goal to halt the rise of obesity and diabetes. And with the focus on obesity and diabetes, a framework for a national management plan was developed. And it meets the requirements for prevention, screening, diagnosis, quality of care, and monitoring and evaluation. And it's based on risk factor and intervening at each transition point on the disease continuum. Each of these transition points can be applied along the life course continuum from the gestational period right through to the elderly years. So in January of this year, 2018, we held a symposium and invited various stakeholders from various sectors to come and make commitments as how their agency would help along the various transitions. And so we were able to convene over 200 different persons from various agencies, not only the health sector, but you got the planning, Department of Planning, Department of Education, several insurance companies to come along and be a part of this planning process. So as a result of this, we're looking at establishing a commission on halting the rise of obesity and diabetes. It was decided that this would be the best vehicle to implement this national plan. We really did not have a national NCD plan, we had a health promotion strategy. So now with this national plan, we think that implementing a commission would be the best route to get the best response. So as I stated earlier, the Well Bermuda Partnership just currently serves as the NCD equivalent, but it has a much broader mandate, and we're still trying to figure out how the two will work together. So addressing the NCDs will require a concerted will, effort, and expertise of government, the civil service society, and the private sector working in partnership. So that's what our plans are at this time, and we'll surely give you an update as to how we progress.
Thank you very much, Dr. Lewin. You set the example, which I'm sure Dr. Owen, Gabriel will follow, notwithstanding what his letter might have said.
Thank you and good afternoon. I'll take some of the time that she didn't use. So, my father, who passed away 7 years ago, had a favorite poem. I would say this was his mantra. It says, I expect to pass through this world but once. Any good thing, therefore, that I can do, or any kindness I can show to any fellow human being, let me do it now. Let me not defer it, nor neglect it, or I shall not pass this way again. And I thought this was important to say in this context for the roles we have to play in bringing our children to a fruitful life, a productive life. And I've named this Lucia NNCDC, Journey Back to Ourselves. Okay, just the outline. We talk about the National Non-Communicable Disease Commission, which was breathed life into by Cabinet Conclusion 282 of 2017, just in September, October of last year. And the members of the commission were 10, and you can see here it was top-heavy. Ministry of Agriculture, Ministry of Education, Ministry of Health, the AG's chambers, the Ministry of Youth and Sports, and Commerce and Labor. So you saw that there was an absence of multi-sector involvement. And this is one of the things that we will attempt to change immediately once we go back. Our limited space availability, so these are challenges that you can't use the human resources available. A 2-year action plan for something that is fledgling, embryonic, is unrealistic to be able to achieve the goals that we would set out to do. We gained lots of information, lots of inspiration from visiting the Barbados National Non-Communicable Commission, and Sir Trevor and Maisha and Sir Trevor were gracious to invite us to HCC to update us on the workings of the inner workings of these kinds of commissions. And then we were lucky to participate in the first virtual meeting of NCD chairs that occurred last year, October. So we looked at structural and fiscal differences that make it difficult for different islands with different fiscal economic structures to progress in the NCD setups. I am happy to say that we were able to obtain cabinet approval for the NCD policy just now in April of 2017. And this is because our minister is championing our cause for the NCD Commission and will seek to make the changes in the composition of the Commission. So we've heard throughout today about the 40 million deaths. We've heard today about 8 in 10 deaths, premature deaths between 30 and 70 years old. And we've heard all of this, the data that is astounding. But I thought it was necessary to point out that this report by the World Economic Forum in 2010, that's far back, says NCDs pose a greater threat to global economic development than fiscal crisis, than natural disasters, corruption, or infectious diseases. And I think this is a telling statement on the impact of NCDs on our countries, the poor countries, low-resource countries, and we need to do something about it. I thought it was necessary to point out as well that our ministries of health have changed their names into Ministry of Wellness, Health and Wellness, and I beg to say that my proposal today is to change our name to a Ministry of Health and Happiness. I think it's more encompassing. And you notice on this side here, the 10 countries shown here, none of them come from the Americas. Not even the United States makes this list. Well, Canada, but the United States doesn't make this list, and the Caribbean certainly not on it as well. But there are things we point out here, apart from the economic differences, the fact that these are no war zones. They are not prone to natural disasters. There are questions of immigration and transportation that make these countries satisfy happiness questions. And these are the main factors: caring, freedom, generosity, honesty, health, income, and good governance. And today we've spoken about good governance as a major factor contributing to happiness. And I think we start thinking about happiness, we will encapsulate the question of health in a broader way. That is not just one thing about disease, it's about your relationships, it's about your sense of freedom, it's about your sense of good governance and all these other aspects that are part of it. These variables here look at other aspects that make differences among the first 10 countries. And again, you see income coming in there, generosity, freedom, having someone to count on in times of trouble, and a healthy life expectancy. So we can't just operate in silos and target just the disease. We have to target the wholesome person, a holistic type of outlook when we talk about addressing NCDs. And I put it to you now, what is your most relevant recollection of happiness in your childhood? For me, it's reading one of those books by V.S. Naipaul or George Lamming or Derek Walcott, you know, reminiscing of the days that you were running around, you know, running around naked under the bush in the rain, or flying your kites at nights and so on. Those are the recollections that we have of girls playing hopscotch and so on. And these are the past. This is what has happened in the past. But we were happy then with other technology and so on. So now we find that we no longer catching Zodom and crayfish in the sea. Anybody knows what Zodom is? And the family sit around the table to have lunch and dinner. Those kinds of things. Walks to and from school. We're now being driven. Okay? We don't read the Hardy Boys and the Nancy Drews anymore. Everybody's on YouTube. So these have changed. There were community games. There were the tales that were told, the local folk tales that were told around, you know. But now, I mean, we also remember walking along to school and picking fruits from trees along the roadside. What's that? So I put this up to see whether anybody remembers those fruits. These are forgotten fruits. You know? Cashew. Okay? Soursop. So did you see any of those here today? No. You didn't. So this is what you see in your supermarkets. Instead of those foods that are what we might term indigenous, that we grew up on, that were readily available and healthy, what we see are those foods that are all imported and preserved and processed. Those are the foods that we see, and those are the foods that our children have access to. The point is, can we blame them if that's all they have access to? Can we blame them? This is what they have to eat. We don't, and it seems that our thrust for development in the past was to produce cash crops on a large scale. So our banana industry took over the fields where these things grew in the wild, and they were accessible to us because of these, attempts to expand our economies. So the unhealthiness of our nation has been propagated by us ourselves in a guide to economic development. Now the Spanish say, "Árbol torcido nunca enderece." What that means is that you can't teach an old dog new tricks. Okay? And once a person has grown with habits that are already formed, ingrained, inculcated in them, it's hard to change those habits. So the question is, can we address our children and make our children the advocates for their own healthiness, for their own health? Can we address our children, target our children, make our children the instruments of change themselves? Can we focus in a different way? What can we do differently? Should we ride the wave of technology and the new environment of technology and social media to make those changes? Do we need new intervention strategies, not just the ones that we are accustomed to, that may not have reached the outcome? We saw our grid here, we have not met any of these priorities. It's not straightforward. Now we need in our team psychologists, we need mass communication specialists, we need people with MBAs in marketing and strategies of product development and promotion. We need monitoring and evaluation. It's no longer just a health team in the ministries. It has to be a team that is similar to the team that our companies use to produce those products that they sell to our kids and they sell to us. It's a different type of strategy. Okay, so something that we can do to our children, and this is what we want to focus on, how to use that technology. Assessment to determine interventions to increase physical activity using existing technology. So there are some motion activated games, like the Wii, that the children do things, swimming, athletics, and basketball, dancing, the Xbox. So they're also using their devices, but they're also in physical activity. You can install a stop game app that will stop children from using their devices at a certain time, an hour, 2 hours later, half an hour later. Absolutely. So another intervention is to create a club called Health E-Rangers, which is an online activity tracking network club for youth, where they look at environmental questions, health questions that they can implement in schools. They can champion the NCD Commission projects, SSBs, No More Junk, Anti-Tobacco and Alcohol, Anti-Pollution Recycling, World Cancer Day, okay, environmental protection, and so on. There's a mascot that we can develop. Let the children become our champions. Let the children become our advocates. Okay, we can call our mascot Dr. Prevention and channel these activities through that kind of endeavor. All right? So you get a point system that is rewarded by private sector. So you can get multi-sector involvement in that kind of thing. So I'll jump through here. This is a proposal for what we could do for our NCD, a multi-sectoral model. So we have a district team coordinator, a district working group that can feed into the regional teams, and also the NCD committee, which is a prevention and control unit. And what the proposal here is to have a joint commission in Parliament, where both sides of the table can unite to create an NCD action group. Okay, so that whichever government is in power, the agenda for NCD prevention and control is the same, whether it's one government or the next, which you see happen often. So this is the kind of things that we would like to address, and not say from cradle to grave, which sounds morbid to me. Let's say from birth to rebirth instead, so that you can living your best life, even in adulthood and in your older years, as it may be. Okay? So I would say here, marketing of indigenous fruits and vegetables, let's create the space for it. Let's just put things in place for Ministry of Agriculture to start harvesting those fruits again, planting those fruits and making it more available to our children. Okay, and making incentives for physical activity in equipment and sports. So once again, I thank you, and I hope you can not be told and not neglect, because we will not pass this way again.
Thank you, Dr. Gabriel. I'll say nothing. I'm called there Mr. Ed Clarke from the Barbados private sector.
Well, I think I only have about 30 seconds, so let me run through pretty quick. Sagicor and our corporate social responsibility. Many people will ask, how did we get involved in this? As I mentioned earlier this morning, so Trevor brought the HCC idea to us, and we were ready to jump on board pretty quickly. Our role in Sagicor and Barbados is to focus on 4 key areas on the CSR side of things: education, health, sports, and youth development. And they all go hand in hand. If you look at it, all of them work together. And if we work together well, we can fight the scourge of the NCDs across the region. We signed the MOU back in 2012, and these were some of the initiatives that we in the private sector through Sagicor worked on. I don't need to go through all of them, but you can see there are quite a few things. One of the things that really sort of woke up the population in Barbados was the fight against cervical cancer. I remember at the time there was a lot of concern about how do we get this message across in Barbados, because you know Barbadians are very conservative people, and it really it was a bit of a challenge. How do we word these things and how do we go about it? But it was done, and it was done very successfully. I think this is one of the biggest things that we did at Sagicor, to fight the obesity among the young children. Now, you've heard about this all day. At the NCD Commission, we discussed this. I'm a member of the NCD Commission in Barbados. We discussed this, and we agreed that we would go to the private sector to get support for this fight. Well, needless to say, they weren't all running to jump on board. We are a largest insurer, and obviously some of these advertisers and marketers are our largest clients. So I had to take the decision at the time for Sagicor whether or not to do this or not to do it. But I said, why not? It's the right thing to do. So we did it. None of my clients came back to me complaining, so that means they're either embarrassed, because I would have told them I didn't agree with them anyway, or, you know, but I didn't see that as a problem. One of the things in Barbados is marketing of these very bad food products to these children at all levels. It's not just the food products, you know, the candies, all these kind of things, the soft drinks we know about, but all these, outside all these school gates. It's not just inside the schools, but outside the school gates. There are a lot of these vendors that sell all of these products, the corn kernels, the cheese, whatever you want to call it. And so it's a wider problem than just monitoring inside the school premises. It's monitoring outside the school premises as well. You know, we all say we don't have money to do this and we don't have money to do that in the private sector. But there's so many things you can do in the private sector without spending a lot of money to promote your corporate image and to promote CSR across the country and across the region. These are all things that we do to help the countries across the Caribbean. You see there the primary schools. We go into the primary schools with our employees. We support the primary. We have a National NCD Commission Drama Primary School Program. That was something, unfortunately, the Ministry of Education, Ministry of Health in Barbados didn't have enough funds, so we assisted in some small amount. We do health fair booths throughout Barbados, across the country, whenever we get an opportunity. So if there's any public event, we try to do a health fair booth so we can promote to the youth and to the wider population. We encourage, we did the Globathon Run. We do that every year. We have done that now for quite a few years. And that's obviously for the below the belt cancers, we call it at home. And that's something that it's a good thing to do. It helps us from the insurance industry, obviously. There's a long-term benefit to the insurance industry. What's the right thing to do? We need to spread the word and just make people more aware. We also do some of these fun days. We rent a gymnasium, we go and do a public fair, invite people, it's free. We come and do these exercises, we do health fairs, we do learn how to cook proper meals, the healthy way. So it's a big educational push. These are all sponsored by Sagicor. One of the things we did recently, we actually launched a mobile unit, a mobile health unit, wellness unit. This bus you see on the left, we are going to be, we actually started already taking out to our clients, meeting with them, having their employees come get tested. Very, very small fee. It is done at basically at cost for us. And the clients and companies will pay for that. And then we also go out into wider communities if there are fairs or something like that. We would loan the vehicle and the nurse. We have a full-time nurse that does that for us. We also do the sort of nutrition workshops at these events. We have what we call a doctor school in Barbados for the primary schools. So all of our salespeople, we have each agency is allocated a school. They go to the primary schools and they work with the primary schools on educating them on healthy lifestyles, the need for physical activity, and so on. We have an arrangement with the CAFIL, UTech, and the Usain Bolt complex. We actually have a complex named Usain Bolt Complex in Barbados. So we have the Gary Sobers and we have the Usain Bolt. So, you know, we actually use that in the university program that we have with them to help train the kids and give them the opportunity to be lectured and so on by some of the leading sports people in Barbados to show them the benefits of physical activity. It's fun, it's not in any sit-down restricted way, it's fun for them to participate, so they really love it. This other mobile unit was in Dominica. This came after the hurricane, so I know we talked about what happens if there are other things that demand the attention of the governments. This is what we did in Dominica. We put a mobile unit into Dominica with the assistance of some of the reinsurance companies. That mobile unit was there to help them in emergency, but we're also going to use it in the future, going around to the rural communities in Dominica. You were asking, how do we align? I think that one of the issues that we face is that the governments, we know, the attention is diverted from the NCDs to these other emergencies. But there are other sectors of the community that can assist. You know, we wouldn't jump in the Zika or the other things like that. But if you get the private sector more involved, I think that the commissions across the region need to be bold and be brave and be willing to go there and work with the private sector. You know, the governments believe they don't trust the private sector, they never have. And very few governments across the region trust the private sector. But the NGOs, the private sector is there to support you. I urge you to try and work more closely with the private sector. Go out there and seek the assistance. You're going to have to knock on doors. It's like selling insurance. You know, 9 out of 10 times you fail, but that one time is a good sale. So we protect that life of that one individual. It is up to us as part of the region to decide we want to do something badly. We focus and go after it. We need champions. You know, in Barbados and the private sector, one of the private sector reps on the NCD Commission. And I hope that the other countries here are doing likewise and encouraging private sector to be part of the NCD commissions. These are some of the, as I said, on the NCD commission, Sagicor is represented there by myself. In other discussions with the various NGOs, Clarke, Cancer, Diabetes, everybody in Barbados, and obviously Sir Trevor and Maisha, very closely associated with them. We stay in touch quite often. We help in the research and publication of various documents and reports. One of the big things we do in the Chamber of Commerce as well, and Sagicor was one of the driving forces in Barbados in improving a wellness drive in the private sector. We created something called the 10,000 Steps Walk, and we had an internal competition in Sagicor to drive physical activity in Sagicor. This was then taken up by the Chamber of Commerce in Barbados and it spread throughout the island. So our employees competed at all levels, from vice presidents down to the messengers. It created a good sense of camaraderie and it also created a sense of wellness that was never there. I can tell you that when we did the pre-program testing, the results will shock you. 90% of our staff are our university graduates, professionals. But you'll be surprised that it's not only the poor people who suffer from NCDs. You'll be surprised that because of the sedentary lifestyles and working behind a desk every day, lack of physical activity, poor diet, the food vans come, they go for the mat pie and the rice and the chicken. You know, they don't go and buy a vegetable or salads and so on. Very few of them eat properly, even at professional level. So the results were very bad. And we saw a significant turnaround in the 6 months after that and the year after that, because we did follow-up tests after that. And I urge you, if you can get your companies in various countries to do likewise. It doesn't take a lot. You know, we give them the little pedometers, little tiny things to go and walk or to do activities to report back. It's not a lot of money. It just needs somebody that's a champion within each company or each association to do it. So these are just a few of the things. The cost of doing business, obviously, from the insurance company is negatively impacted by the NCDs. You know, some people ask, well, is that why you're in it? I said, no, I think that the NCDs, I can see it in Barbados. I've seen it in my family, my own family personally. 2 members died from NCDs, 2 or 3 members. And, you know, I myself suffer from hypertension. There's no, I mean, I'm sure many of us in here have it as well. Yes. You know, so let's be honest and say there are reasons why we need to fight this scourge. And our lifestyles have to change. I personally have changed my lifestyle quite a lot since we started this wellness drive in Sagicor, and I can tell you that it's benefited me tremendously. But I believe the cost of doing business from the private sector has increased tremendously by the sick days, lack of productivity, and the absenteeism and the presenteeism, because we have a lot of people that come to work and they're producing at half rate because they're not healthy. And we see it every day in our lives. So I know time is running out. So I think hopefully I've covered some of the things, but I urge you once again, don't be afraid of the private sector. Get as many involved as possible. We are not all alcohol companies or soft drink companies or sweet drinks or sweetie companies. We have a lot of financial institutions. We have a lot of non-manufacturing institutions across the region that can help. And I urge you to try and work closely and get some assistance. Thank you.
Thoughts are not among those who suffer from hypertension, but after managing this team, I think I need to get my question. One person can perhaps help you there, and it's someone that I have known quite long, and I'm sure he'll be able to assist in keeping the pressure under control. I invite Professor Fitzroy Henry.
Thank you, Vincent. I will try. I'll try my best. I was asked to talk about the Food Industry Task Force in Jamaica. Let me make it clear that this is not the NCD Commission. The cabinet in Jamaica recognized that it's very important to interact with the food industry, and they had set up this Food Industry Task Force. And as you can imagine, the need is to interact with commercial interests who produce and market the unhealthy products that contribute to obesity and NCD. So how do you do this? So there's an easy part of this, and there's a difficult part of this. The easy part is to identify what the goals and objectives are, because you look and see how the food industry is involved. The difficult part is what you were asking at the beginning of the session. How do you deal with those issues of conflict of interest and blah, blah, blah. So with that introduction, let me try. Okay. The mission that was given for the task force is simple: to formulate strategies that can improve the dietary environment and contribute to the reduction of the burden of NCDs in Jamaica. So to halt obesity NCDs, what we did initially is to identify 4 areas of focus: product reformulation, marketing of foods, labeling, and advocacy education. I should include advocacy and communication. So let me deal with the easy part first, which is just the goals. And the goals we have set for product formulation is reduction of fat, sugar, salt content in products to meet national standards, mandatory removal of trans fats in all products, and the food service outlets and vendors to improve the quality of the food sold. In terms of marketing, the goals we set are mandatory standards for all foods in the school based on the food-based dietary guidelines developed in Jamaica. Reduction in the portion sizes of allergen foods and beverages, limitation of sale and sponsorship of unhealthy food products in schools, and reduction in children's exposure to unhealthy food advertising through all channels. In terms of labeling, and we heard a lot about this today, mandatory, moving from voluntary, mandatory nutrition facts panel on packaged foods, standardized, understandable nutrition labels, this is basically front of packet. Mandatory nutrition labeling on menus, menu boards, and in restaurants and other food outlets. And the last one, communication advocacy, massive public education and specific training on various initiatives. Support manufacturers and vendors in using healthy ingredients. Explore fiscal measures to increase the availability of healthier foods. And the last one is really symbolic, even though it's important. And that is if we can get mandatory use of health meals and snacks in all government functions. Well, if we are taking the lead on this, at least we should make an example. Even though it may not make a big difference, but I think that one is, like I said, it's symbolic, but it could be even important. All right, Mr. Chairman, that's the easy part. Now we come to the difficult part. And unfortunately, I was asked to chair this task force. We were in operation just over a year. And the thing is to assemble a team that can deal with these issues. So let me introduce the task force. We have senior representatives from the Ministry of Health, and some of them are in this room. Ministry of Education, that's Youth and Information. MICA, and you have agriculture buried somewhere in there. Ministry of Finance, sorry, it's Ministry of Industry, Commerce, Agriculture, and Fisheries, okay? Ministry of Finance, necessarily so, because especially with the fiscal measures, we need to get that input, and of course, the Office of the Prime Minister. In academia, we have the three major universities involved, the NGOs, Heart Foundation of Jamaica, you heard a lot about them today, Diabetes Association of Jamaica. We have, not that we excluded the Cancer Society or the others, but these are the two that are mainly Heart Foundation is a good partners you will see in a while. And then we have government agencies such as the Consumer Affairs Commission, the Scientific Research Council, the Bureau of Standards, and Jamaica Broadcasting Corporation. And then we have other important others, like the Vendors Association, to get the, like, informal group, and media that don't turn up to any of our meetings. It's true. And of course, we have the private sector organization of Jamaica, Manufacturers Association of Jamaica, the Chambers of Commerce, and there are 4 different chapters across Jamaica, and 15 or so large and small food industry partners. So with that wide range, the challenge now is how do we organize ourselves without hitting each other on the head and wasting time just brainstorming, because you can bring a group together and all you do is argue. So we have to have some key principles, and the key principles really, we have to look at the ethics of what we're doing and the transparency of what we're doing. So the terms of reference was clear about conflict of interest, and in fact, one potential partner was rejected. And thanks to the Heart Foundation, who actually alerted us from the tobacco days, and we had to reject that person, entity. And our subcommittee meetings, because before were broken into subcommittees, they are documented to ensure transparency and also continuity, because we didn't get all 15 industry partners together. We needed to document it so that we don't have to go over every time. And I think ethics and transparency are things that we have learned that are important in engaging with the private sector, at least in the food industry. And then we have to deal with risk management. We have to be clear about who should be involved in the drafting of the policy, whichever policy that we're dealing with, the initial policy. And I think that this was important for us to do. Then the next stage in this is before approaching the food industry partners to discuss and negotiate. So we had a clear picture of where we wanted to go, and then we discussed with the food industry to get their feedback and have a discussion and then negotiation. But what was important is that we had our boundaries of compromise quite clear. So when we're discussing with the industry, we know what is non-negotiable. So if you want more time to do this, that's fine. But if you want to change the standards, there are certain things that are non-negotiable. And this was important for us to move forward in terms of engaging the food industry. What has been the experience today? Overall, it has been good. The interactions have been overall good. The thorny issue, as expected, was on the sugar tax. Okay, because that hits the bottom line. Other things do, but that one hits directly. But this is overall. Let me go specifically to product reformulation. In terms of trans fat, all stakeholders agree that this must be removed from the food supply. There wasn't any argument about this when we had the engagement of the industry partners. They all said that they all claim that they do not use it or they're not aware that they're using it. Well, the thing is that we are operating in a state of blindness right now, right? Evidence blindness. But we're going to have independent verification. This will come later this year, and the strengthening of the Bureau of Standards and the Science Research Council labs that I think Lucia might have mentioned. We're doing that in Jamaica for the 3 countries, but I think it will in time be open to all the region. Because I don't think there's any single lab that deals with the 4 key ingredients that we're concerned about. And this is what this project is going to help with. So that when they tell us that they have no trans fats, we can now take samples and verify. And I think this is an important development. Again, on product reformulation, ingredient reduction. Several large manufacturers publicly announced between 20 to 50% reduction of sugar in their popular products. And some are pedigree food industry partners in Jamaica, like Lasso, Separate, National and Purity Bakeries, Nestle, and others. They are claiming massive reductions. Again, we don't know the starting point. So if the standard is there, you're going to say 20%. We don't know how far you are from what we think is a healthy level. Okay, but it's good. It's encouraging, and we really welcome the announcement by these large companies to do this. And similarly, independent verification we're going to do through the lab in a similar way. What about labeling? Agreement to move from voluntary to mandatory of packaged foods with the new label. As you know, there's a new label out there globally, led by USA. And we have introduced in our subcommittees this new label. The only little sticking point is what micronutrients they want to add vitamin D. We're not sure we should add vitamin D. Things like we want them to make sure we maintain vitamin A and C. In America, they don't want that. But the main things in terms of added sugars and so on in the new label, those are very common. And the industry partners are happy about that because they don't have to make 2 labels. And America doesn't mind if you have an additional micronutrient. It doesn't matter to them, they will use it. So it's just 1 label they will have to make. So they were very happy about this. So most of them don't do the labels for export anyway. And the US deadline of July this year was a great boost to us in the task force because when we had the meetings, they say how long it's going to take to change, but they know that they had to change their labels if they want to export their product to the United States July this year. Unfortunately, I'm now hearing that the deadline was from the US lobbying has now pushed back. So I'm not sure, I don't know if anybody knows, I think it's a year and a half or something, they put it now back from July, which is not good for us because we're holding our local and saying, okay, you have to do it for the US, so July this year you should change your label similarly and blah, blah, blah. Anyway, but we will still, there isn't a major problem here. It's a question now of the time frame. The timeline for compliance is the key issue in terms of labeling. On education and communication, massive public education on sugar-sweetened beverages, and you've seen it. And Debbie from the Heart Foundation and others talked, and you've seen the ads here. It's really unprecedented positive response from the public. You've got the episodes and the interactions about everybody talking about Rosie and the other, everybody knows. Since I've been in Jamaica for what, 20, how many years, I haven't seen a public education campaign on an item, you know, like this. It is massive, and it is, ask anybody, they will tell you about it because it's everywhere. It's very, very positive. Our foundation indeed needs to be congratulated for it. But guess what? There was also unprecedented negative response from one beverage manufacturer crying foul because that manufacturer is saying, and the first ad really had a bottle, it didn't have Coke in it, but it looked like a Coke bottle. So they're saying, there are other things out there that are bad as well. Why all these adverts are, you know, targeting, but you will get that kind of response. However, with the new phase on sugary drinks, which include low-box drinks, and the other types of drinks, the pushback has waned somewhat. It's like, it's not me alone, right? It's actually the others as well, which was fine. So Heart Foundation, good for that. And of course, we need more ads needed for the other ingredients, but that will come in time, and as you know, it is expensive. We're talking about millions of dollars to do these ads. Media, unfortunately, in the region, isn't cheap. Unless you have about 40 cable channels that have nothing to put on, you put on something on health. But the main channels, you have to pay, and pay a lot of money. So the media partnership is something that needs to be worked on, and I would entertain any ideas of how we can get the media to be more socially responsible. Then, of course, the sugar tax. So the core group, we compiled a lot of evidence on the health, the economics, the social. We had a big symposium in January and many other things, getting public responses about it. Some industry partners insist on self-regulation, which of course is not an option to recommend to the government. So in the discussions, we made it clear that the government is not going to allow you to self-regulate. In other words, giving up their responsibility to the private industry to regulate. So after lots of discussions, they came around and started talking about timelines for intervention. So we don't know what the timeline is. There's no official announcement yet. On May the 1st, which is in another few days, a debate might better inform us. I don't know if the minister is going to be making an announcement in regards to the tax. And when it will be implemented, we don't know. But the recommendation from the task force is clearly based on the health, economic, social analyses that we have done, that it is something that can make a difference. A new nutrition policy and standards in schools is something that we worked on as well in terms of marketing. Difficult for many of the food industry partners to comply with this. It's the sanctions by government for non-compliance that will determine the success of this one. Again, we will hear more, I think, in the budget on May the 1st in terms of what is happening in schools from September this year. So what are the major challenges? The major challenges are branding and sponsorship of unhealthy foods in schools. That is one that we haven't tackled yet, but is one I anticipate will be a major challenge for us. You may not know, but we have some schools in Kingston where the fast food industry is the main provider of lunches. Yes. And we understand that is because they came forward and they made an offer and nobody else did, so the schools on board allowed them to. Whatever the reason is, that is the case. And of course, advertising of unhealthy foods via all media, not only social media as well as. So these are two challenges we see going forward for the task force. The opportunities are great because we have strong support from the Bureau of Standards, which is the legal authority to do these types of standards. And they work closely, as you know, with Prof. Science Research Council, they will assist small producers to reformulate. The big ones like Grace Kennedy and LASCO, they have the means to reformulate. But we have the Science Research Council, which will help the smaller ones who are not able to do the reformulation, either because the technical knowledge or the analyses that they need to do, the testing and so on. So that is a big plus for the task force. We can help small producers to reformulate if and when they are ready to do so. The Vendors Association, they are important in terms of the difficult to reach market. Grace Kennedy keeps saying, you know, you're attacking me, but what about the man in the street there, the bag juice man that they sell into the schools? They all contribute, and it is true. So the Vendors Association and the small industry people are very difficult to reach. And of course, leadership support is very important at this time. The Prime Minister, the Minister of Health are very strong, and I hope it persists. The election is not until another 2 years. And I say that advisedly because you know what happens, right? So now is the time to strike. The iron is hot. And then the knock-on familiar tactics by the food industry. Lobbying in the media against the sugar tax, the Jamaica Manufacturers Association finance measures for new nutrition standards. They're trying to do that. Attempts to discredit the task force and leadership, and all have been rubbish. So, what are the lessons today, Mr. Chairman? Inclusion of critical members in a task force or any other assembly to deal with these issues. I mentioned the importance of the different members of the task force. Ethics of participation, which I mentioned, transparency in the process, anticipate and manage risk, secure, sustain financing, and of course, garner political and public support.
These, I must admit, were all interesting presentations, difficult to stop, and quite frankly, I wish I could give you 10 more minutes each of them, but we can't. With that being said, let me thank the panelists for their presentation. I suppose he joined in. Okay, I really didn't realize Dr. Coombs was among the panelists, which means that your time has been taken up. But no, in all fairness to you, we'll have to allow you some time. So, with this, I invite Dr. Coombs.
Thank you very much. It has been a long day. One of the benefits of being the last speaker, notwithstanding the fact that the former speaker took all my time, is that what I was about to say has already been said at least 3 times. And therefore, I should be able to finish in 3 minutes. The HCC has been a formidable force among civil society organizations in reining in the epidemic of NCDs in the Caribbean. We impact and advocate CARICOM, Ministries of Health, Chief Medical Officers, PAHO, NCD Alliance, Caribbean employers, and NGOs from as far south as Suriname to as far north as Belize. Through a vibrant and energized secretariat and an indefatigable leader in Sir Trevor, we focus on the matrix you see there The 4 NCDs, the 4 major risk factors, and the 4 pillars of advocacy, mobile health, capacity building, and communication. Ambassador Rattray, Dr. Cummings, and Maisha had completed most of what I was about to say, but I would simply remind you of the 9 voluntary global NCD targets, the key determinants of NCDs, and share with you a worksite wellness research done by Dr. Williams through the HCC, looking at employers throughout the Caribbean. The outcome of that was that 80% of the companies present had some form of worksite wellness. 37% had ever conducted a health risk assessment. A company in Barbados took on the task of reformulation, and they were able to reduce salt in their intake while making bread. This is what they had before in 2012, and this is what they had in 2014, showing a 20% reduction in overall salt content in bread, which is eaten by all citizens in that country. This basically shares with you the fact that if you have a tape, a height and weight measure, a blood sugar, blood cholesterol measurement, and a free software from the American Heart Association, you can produce this type of statistics, which any employer, when he sees, would provide you with some funding to be able to do some NCD research outside of the company, as well as continue in the company. Here, again, using the American Heart Association cardiac risk assessment, you can find out the risk of your employees dying from a heart attack within 7 years, and that piece of software is free of charge. And here again, you can see who are smoking, who have high risk, and who are exercising. Again, here, looking at a company by simply asking 7 simple questions, you can determine what's the prevalence of hypertension, diabetes, asthma, also in that company. And from that, you can then project some form of intervention as far as the wellness program is concerned. The HCC has published at least 20 different publications on a variety of aspects of NCDs throughout the Caribbean. And I will close by saying that Bob Marley, the most famous Caribbean son, had said that you need to chase those crazy bald heads out of town. But I say to you, we need to get the heads to New York. Can you stand for me? Just stand, everybody. Just stand. Just stand right now. Stretch your legs, we are ending. What do we need to do? Get the heads to New York. What do we need to do? Get the heads to New York. Thank you very much.
Given the time constraints, I'm sorry there will not be questions, but if there are any concerns that you have, of course, there will be an opportunity to raise those tomorrow. I would invite you to give the panelists, the distinguished panelists,